Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Breaking news, the first 3 cases of the UK variant has been detected in Rhode Island. We don't know when it started, and we don't really have any good idea of how many actual total cases there are. Let's go to Dr. Michael Fine. He's the former director of health. Dr. Fine, how does this change everything in Rhode Island in the battle against the coronavirus?
Hi, Josh. In a certain way, it doesn't change anything. I was expecting that to happen and had assuming that the variants were already circulating 2 or 3 weeks ago. I think we're going to unfortunately see the number of new cases start to rise, followed 2 or 3 weeks later by the number of hospitalizations and deaths. I think we're getting ready for our 3rd peak. Dr. Osterhelm in Minnesota suggests the next 13 or 14 weeks are going to be our hardest weeks yet. I can't confirm whether that's true or not. A lot depends on how fast people get vaccinated. But if we don't burn rubber and get half the state vaccinated in a few weeks, I think he's probably right.
He, of course, has been one of the leading public health experts on this at the University of Minnesota and is a member, or was a member, of the transition team for Biden looking at the coronavirus. Massachusetts this weekend announced that they had detected 10 more cases. They're up to 29, I believe, total cases of the UK variant. It has 2 attributes which are both a significant negative. Number one, it is somewhere between 50 and 70% more contagious, and now UK scientists have come to the conclusion that it is deadlier than our normal variant of the coronavirus that we've known since last March. How does this, being A, more contagious, B, being deadlier, impact how the state should be strategizing against this? Also understanding that while many are asking for greater restrictions, the state of Rhode Island lessened restrictions and opened up bars this weekend.
Yeah, I think opening up bars, I think if a physician were to do that, that almost feels like malpractice to me in the face of what we're seeing. Public policy malpractice. Until we know this disease is under control, we can expect that our existing social distancing and masking approaches will work considerably less in the face of a fast-spreading variant. CDC has now suggested people either wear N95s or double masks, but we need to get that started right away. And I think we need to dial back any loosening and maybe tighten up considerably if we're going to protect ourselves against this variant.
Listen, when you start to roll out the math of something that's 50 to 70% more contagious, we've actually been at, I hate to say it this way, a low. We're still at hundreds of cases every day, but we're at a lower number than we've been in months. Hospitalizations are down substantially, now under 200. But what happens to the math when you start getting a variant that is this much more contagious?
Well, if you can't stop it with vaccination, you start to see exponential growth, considerable rapid growth, so that we go, we'll start seeing cases doubling and quadrupling, and maybe more than that week over week. Every 5 days, expect to see cases doubling or tripling, and as soon as that starts happening, the variant is widespread.
Dr. Fine, each day we run CDC's numbers as to how many doses Rhode Island has received, how many doses have been administered. The gap now between the number received, about 230,000, and the amount administered is now over 87,000 doses. Rhode Island hasn't beaten, I don't believe, 5,000 in any one given day. That is nearly 20 days of doses that are gone on a shelf to be administered under some insane policy from my standpoint that aren't getting in people's arms.
Yeah, and I actually saw this morning that our allotment is going to go up by 20%. So we need to take that extra dose and get it into people's arms. You know, Josh, you and I talked on Friday a little bit about how they're doing this in Alaska. I looked at that with a lot more precision over the weekend, remembering that I had spent 2 months in Bethel, Alaska, and know it pretty well. And in Alaska, they are, you know, they're using small planes to fly out to the villages. They're hauling vaccine on dog sleds behind snow machines. They're moving the vaccine every way they can to every single village and every single neighborhood. That, you know, I mean, that's the level of focus that we need, and that's the level of commitment we need to getting this thing stopped. And the vaccination piece is critically important right now. We don't have a second to waste.
Yeah, listen, if you were trying to design the most ineffective vaccination program, Rhode Island might have achieved that. We're last in New York Times. I think we're 46th or 47th by Bloomberg, and Becker Hospital, the trade magazine, has us dead last in implementing the vaccination program. And yet, there is no change. There's no change in administration of it. There's no change in oversight. There's no change in policy. It just continues to be week after week ineffective. That's the kindest word I can possibly use to describe how Rhode Island has managed to vaccinate 1 million people, 40 miles by 55 miles. We all have each other's cell phone numbers. It's just, it's beyond belief. Let's jump over to the deaths this weekend. 54 deaths over the 4 days. This thing's not letting up. We're going to be, you know, we're on pace to be high 300s, maybe even over 400 if this death rate continues.
Yeah, I need to double check it, but 54 deaths in a week, that's about the number of deaths we have from motor vehicles in a year. That's all our car accidents in a year that we have in a single week.
In 4 days. In 4 days.
Yeah, in 4 days.
Yeah.
So this is not small.
Dr. Fine, you know, Rhode Island's lagging in vaccination, and there's no national narrative coming out of the White House or CDC chiding some of the states that are proving to be ineffective at this. At what point should the federal government intervene? Should the CDC and U.S. Army troops come into Rhode Island to implement a vaccination program? We're now more than 2 months into this, and we're dead last. We're the most densely populated, second most densely populated state, and we cannot figure this out. Connecticut is in, I believe, 9th or 10th, a very similar state. Massachusetts has flown by us. They were behind us. They've flown past us, and we're still lagging in last place.
Well, I certainly think it's worth devoting any resource we can to getting this better. That it's gone on this long is very hard to watch for what is otherwise the best vaccinated state in the country. The time for us to succeed is now, not months from now.
I go back to the spring. Governor Cuomo is under tremendous criticism for 2 things. He is for not reporting correctly the number of nursing home deaths, implying that they took place in hospitals versus nursing homes, and that their death rate for nursing homes, total population, was significantly high. He defends himself by saying, listen, we're racing so quick, we're just trying to get them recorded. We didn't mislead in the total number of deaths, just where the actual individuals passed away. And second of all, he said, listen, we did the right thing. We didn't take nursing home patients who had tested positive and return them to nursing homes. Let's go to Rhode Island. In the case of Rhode Island, we did do that. despite the best science, the best policies coming out of Washington almost 6 weeks before Rhode Island got hit, we returned patients who were infected back into nursing homes, causing tremendous number of deaths. And secondly, our rate of deaths, of the overall number of folks who have died in Rhode Island, we're over 70% of the deaths were in nursing homes. If Governor Cuomo should be criticized, shouldn't Rhode Island officials, Governor Raimondo and the Department of Health, be criticized that much more?
Well, I think in the United States, we have totally failed at this. And I think governors, I talked about public policy malpractice. I see it every day and in every way. Josh, I'm just embarrassed. I looked this morning again at international numbers and made some international comparisons. You know, the nation of Australia has had 1,100 deaths in a nation of 25 million people. 1,100 deaths. We've had twice as many for the whole country, just in Rhode Island.
Yeah, we've had twice as many deaths plus in Rhode Island than Australia has had at 28 times the population.
Yeah, in South Korea, they've had 1,500 deaths. Things suddenly got worse in South Korea about 2 months ago, and they went from 500 to 1,500 deaths in a nation of 56 million people. 56 times our population, and we still have more deaths than they do. Our rate of death dwarfs most places in the country. You know, and somehow we have been sort of saying this is okay, that we're not much worse than other states. I don't think it's an adequate excuse. I think it's time for us to stop making excuses for ourselves and our leaders and start telling ourselves the truth. We failed at this.
A couple of things that the public should know. You could have had COVID-19, recovered from it, and now could contract the UK variant, B.1.1.1.7, correct?
Well, we don't know for sure, but you know, it's always possible. And I don't know how much protection that having had COVID will bring to this variant. We just don't know how common it's going to be. Time will tell, but certainly we've seen reports from around the country, or really around the world, of people getting a new infection with a different variant, and that is behavior that is very much like the coronaviruses as a class.
The only good news out of all this, with the spread of the UK variant now hitting Rhode Island with multiple cases, is that it appears that both Pfizer and Moderna vaccines are effective against the new UK variant.
Yeah, effective, but perhaps a little less so. We will see. You know, when we see widespread disease, we'll see what happens. And I hope they hold. And, you know, I heard this morning that there's a discussion of the announcement of many new variants in the United States that have evolved in the United States. And that's what I would expect. And I think we have to really watch out for because we've let this disease run rampant. Again, when I think about how this disease has run rampant and the likelihood of creating the conditions under which new variants can evolve, that to me is public policy malpractice of the first order.
Dr. Michael Fine, I want to thank you so much for joining us each day during the week, and greatly appreciate your insights. For everyone else, stay tuned for more updates. We have more details up on the site on the new cases here in Rhode Island. It's disturbing news, maybe not a surprise as the UK variants began to spread across the United States. Also understand that both the South African variant and the Brazilian variant have been detected in the United States, and we're likely to see some level of spread of both of those new strains. So for everybody, I can't say it enough, you've got to wear your mask, you've got to stay safe. This is tricky times for all of our public health, for our families, for our friends, for local businesses. Everybody stay safe, and please, please wear your mask.
Thanks, Josh. Please mask, double mask, or wear an N95 when you can.